Hi, my name is Kaylee Walker. I am a registered nurse at Conemaugh Hospital, and I've been a registered nurse since February of 2012. Originally, whenever I was assigned this project, I sat down and thought about it and thought about what is a communication barrier that I see in my hospital from my own perspective. That is something that is a huge problem and something that could be done about it. So I thought about it and I came up with language barriers in the workplace with a focus on healthcare because that is something that I'm very, very familiar with and have had personal experiences with. I will begin by starting with a scenario. Imagine you, as the patient, are admitted to the hospital and specifically you do not speak English hardly at all. So you're admitted to the hospital and the doctor comes in to talk to you and to see you, and the doctor does not speak the native language that you speak and continues on to tell you what your diagnosis is, what medications you will be on, what you will be taking, and what the plan of care will be. The doctor goes through everything with you and then leaves the room. Then the RN goes in the room and talks with the patient as much as she can, and the patient is very upset because they have no idea what they've just been told, and the doctor did nothing about it. This is a huge, huge problem. Even though we are living in a small community and Johnstown is not that big, this is something that I've seen, and it's something that is a huge problem and that needs to be addressed. I've even also encountered where patients will come in and they do not speak English well, and they have family members that do speak English, and the physician will come in the room and use the family member or friend as an interpreter for what he needs to tell the patient, and the doctor feels that that is acceptable and that the patient is receiving the proper message and will leave the room. Once again, that is not okay, because even in that situation, after that's been done, I go in and talk to the patient as much as I can, and the patient is upset, has no idea what's been going on, and the plan of care is at an all-time low, when in hospitals the plan of care should be up here because the patient is our number one focus. So this is something that needs to be addressed, and it is important in my eyes. For most of us, it is difficult to feel vulnerable even if faced with an extreme situation. In the current era of global Americanization, cell phones and Blackberries, the internet, and post-9/11 security-mindedness, it is hard to even envision, much less experience, a scenario in which we have no English language lifeline in the event of an emergency. Perhaps this is why we, as a profession, an industry, and a nation, continue to drag our feet in addressing the problem of language barriers in healthcare, despite the millions of Americans whose care is compromised on a daily basis by fear, uncertainty, poor quality, and potentially life-threatening medical errors caused by the inability of doctor and patient to communicate with each other. Limited English language skills can hamper an individual's access to health information and services. But the language barrier can also be a burden for some English-speaking health professionals who provide care and resources to speakers of other languages. I had the opportunity to talk to Josh Rosman, a certified registered nurse practitioner at Conemaugh Hospital, and he provided the interviewer, me, with his thoughts on the language barrier issue in the workplace. And this is what he had to say. Oftentimes in the workplace, information is misunderstood by patients and the staff. This is due to various reasons, such as differences in languages spoken by the staff to the patients and family, and vice versa. Each year, the amount of non-English speaking patients admitted to the hospital is increasing every year. It is crucial that we accommodate those with limited English proficiency. And he is absolutely correct. It is our job to accommodate those patients. Dr. Cooper of Jefferson University Hospital describes his personal experience with language barriers in the hospital setting. There are Chinese immigrants, Vietnamese immigrants, Cambodian, and Laotian. We've seen a lot of Indonesian immigrants lately over the past couple of years. There is a huge language barrier, and it is a major factor in the care that they get. If I am giving instructions, for example, on how to take a medication, and it is not communicated clearly, the consequences can be very severe if the person takes their medication incorrectly. But it is also very big from the standpoint of just having that personal connection in the patient-doctor relationship. We need to be able to help health professionals become better health professionals for this community. He's absolutely correct. We as health professionals do need to be better for this community. I've included a graph, as you'll notice, in the PowerPoint, and that is all about patients who do not speak English as their primary language having greater problems with communication, as you can see in the chart. A 43% amount of Hispanic speaking people have one or more problems with communication. Then you have a 23% decline where doctor listened to some or only a little of what the patient had to say. Once again, a huge problem, and I think that the graph gives a good description. If you look at even what's in between those two, the bottom number and the top, you'll see other problems as well. Language barriers are increasingly present in health care in the U.S. The proportion of the U.S. population with limited English proficiency is growing every year. A fact that I found, according to the U.S. Census, an estimated 47 million people in the U.S. speak a language other than English at home, and the proportion of people who speak English not well or not at all almost doubled from 4.8% in the 80s to 8.1% in 2000. Imagine what it's like now in 2012. Having limited English proficiency is a risk factor for health disparities. It can result in decreased access to preventative health services, decreased satisfaction with care, poor understanding of instructions or medications, longer hospital stays, and an increased risk of medical errors and misdiagnoses, like I described earlier with a personal experience that I had at the hospital, describing a language barrier between the physician and the patient. Studies suggest that communicating to patients in their own language improves patients' compliance and understanding of their diseases. Patients' self-reported well-being and functioning, and access to primary care and preventative services. Studies suggest that accurate communication between patient and provider decreases unnecessary